Patient advocacy groups play a really important role in the Australian health system. There's confusion amongst some people about what it is that the patient groups do and what the best way is to actually engage with them. But the pandemic has really brought into sharp relief the kind of role that the patient groups play. One of the things that we've seen through the pandemic is that consultations with healthcare professionals, screenings and diagnoses are all way down from where they should be. So patient groups have been one of the main organisations reminding patients of how important it is to stay connected with the system, how important their screening and their consultations are, and their work has really come into sharp focus during this phase. So whether that's been supporting the broader Don't Wait Mate campaign, which has brought a whole heap of stakeholders together, or whether that's in the case of some patient groups where they've been applying that message to their own disease area, like Don't Wait, Investigate, as has been done by the Lung Foundation, they've all been doing really positive work. They really bring in the personal dimension to discussions around health policy. So if you look at the Leukemia Foundation campaign, Breaking Barriers, it's very much built around personal storytelling, patients explaining their experience with a particular disease, and it's a very powerful way of raising awareness about a particular condition. This role then becomes really important in the way it inputs into decisions about which medicines and which devices are reimbursed by the Australian system and in fact by the Australian taxpayer. Because without the patient perspective and without the patient voice, these decisions are largely being made by health economists, by bureaucrats, by healthcare professionals who would likely have a tendency to focus on more the medical, technical side of what's going on, and what can be lost is the patient voice. Migraine patients have been very active in the public discussions about the extent to which new migraine medications should be reimbursed by the Australian health system. In a sense, those groups have been holding bureaucrats and decision makers to account and making sure that they include the patient voice in the kind of decisions that they are making. At other times, groups are commissioning reports and new research into specific diseases to try and raise awareness. So whether that's Hearts for Hearts and their recent work in atrial fibrillation, or shining a light on diseases which perhaps affect Australians more than they affect other people around the world, like the work that the melanoma groups have been doing on melanoma. Either way, you've got to take account of the work of these patient groups into your healthcare planning. They've got the ear of media, they're influential with stakeholders, politicians are taking account of them, so they're really influential players in the broader debate. If you're wondering what they do, they get manufacturers, politicians and others focused on patients. And after all, that is really what the Australian health system is supposed to be about. Just keep in mind when you're planning, patient groups are major players.